Good afternoon, everybody. Thank you for coming today. Um, my name is Desiree Whalen. I'm with the Whalen team of Keller Williams Innovate, and I appreciate you coming to our monthly Lunch and Learns. Now, you will get a recording of this, so please feel free to forward it to any of your friends or family that you think would benefit from it. I am going to introduce Peter Fournier. Did I say your name correctly?
Yeah, very good, Desiree.
Very good. He's with All Things Insurance Group, and he is local, which is awesome. And the reason why it's a little bit different than I thought, most of our lunch and learns, but I follow this lady who talks about Medicare. And even though I'm not really near it yet, I still probably have about 10 years from it. I still find it beneficial because my mom is on it. And it is incredibly confusing. It's ridiculously confusing. And so I just thought this would be beneficial for you guys, anybody who's near it or wants to learn more about it. So Pete is all things knowledgeable about it. So I'm going to have him start. We will leave time for some Q&A. So feel free to come off mute and ask questions or put them in the chat. And why don't you take it over?
Awesome. Thank you so much, Desiree. I appreciate it.
You're welcome.
As Desiree said, my name is Pete Fournier. I own All Things Insurance Group. We're actually headquartered here in Wilmington, North Carolina, even though we have about 480 agents across the country in 43 states. So if you do have friends and family outside of North Carolina, they may need help with life insurance, Medicare, annuities, retirement planning. We can certainly help in that regard. I've been in the space for 14 years, and as Desiree stated, Medicare gets more and more confusing every single year. And it really depends on who is running the administration from year to year too, as changes progress. So today I want to give you a basic overview of what Medicare is, the enrollment periods, how it pertains to what your costs are going to be during retirement, and then open it up for any questions at the end. So today we're going to learn Medicare basics. We're going to talk about Medicare supplements and Medicare Advantage plans and how they differ from each other and the pros and cons of both. Prescription drug coverage overall, as well as important dates for enrollment details. So the cost of healthcare in retirement is extremely concerning. The American population over the age of 65 spends $3.8 trillion over the course of Medicare spending. And the projected annual growth in healthcare spending goes up about 5.4% every year, estimate, between 2019 and 2028. Here's just a basic graph of healthcare premium costs and how they affect you during retirement age. This was a 20-year study that was done between 1999 and 2019. They show the cost of overall inflation, our milk, bread, cars, houses, etc. Goes up about 45% over the last 20-year period. Workers' earnings slightly over inflation, which is also scary, at 61%. But health insurance premiums have gone up 255% from 99 to 2019. And this accounts for both private sector health insurance, if you're a W-2, if you're 1099, if you're going on the open market or the exchange, as well as our Medicare beneficiaries that are either paying Part B premiums, Medicare Advantage premiums, or Medicare supplement premiums. Now, traditionally, most people think they're going to be in a lower tax bracket or spend less money, hopefully, knock on wood, during retirement. But unfortunately, seniors spend more on healthcare after turning 65 traditionally than they did during their working years. So it's my job, as well as our agent's job, to keep those overall costs down versus going to just original Medicare, which we'll talk about, which can, excuse my French, gouge your eyes out over the age of 65 from a spending perspective. So what is Medicare? Medicare is the largest health insurance program offered in the United States. There's about 10,000 people turning Medicare eligible or turning 65 every single day. So it's 100% the largest health insurance program that we have. It's run and governed by the Center of Medicare and Medicaid Services, which is a part of the U.S. Health Department, and is a government-sponsored program. Part A and Part B, if you guys are taking notes, and obviously you guys will get the recording too. Part A and Part B, as far as this presentation is concerned, it will be known as Original Medicare. Part C is designated as Medicare Advantage. And Part D, that's an easy one to remember, is for prescription drug coverage as we go forward. So Original Medicare that's offered by the federal government has Part A and Part B. Now, typically, Part A is at no cost for most seniors that age into Medicare. If you worked 40 quarters and paid into Social Security over the course of 10 years, essentially, you'll receive Part A at no cost. Part A covers hospitalizations, skilled nursing facilities, hospice, home health. If you want to make it easier, Part A is a lot of inpatient services, hospitalizations, overnight stays, etc. Part B is what we pay for, and the premium changes every single year. It can go up, it can go down, it can stay the same. And again, it has a lot to do with the administration that is running the government at said time. Part B is more outpatient services, doctor's appointments, outpatient care, occupational and physical therapy. Part C, as we talked about on the prior slide, is Medicare Advantage. Part C helps cover the gaps that Part A and Part B don't cover. Just to give you a generic overview, Original Medicare, Part A and Part B, is an 80-20 health plan. If you worked a W-2 job or you work a W-2 job now, you may have a split on co-pays and co-insurance between the health insurance and your employer. In this case, the federal government or Medicare in general is going to pick up 80% of your tab. Okay, if you're just on Original Medicare, 20% is on you. However, there is no max out of pocket on that 20%. So if you had open heart surgery and it costs $500,000 and you're on Original Medicare, you owe 100 grand. No way around it. If you have a doctor's copay and it's $100, you owe 20 bucks. No way around it. So part of the way to cover those gaps is enrolling in Part C, which is a Medicare Advantage plan. Also, Medicare Advantage plans cover additional services like dental, vision, wellness visits, etc. Part D, and we'll touch on this in a couple slides, is almost mandatory that you enroll into. Even if you're not on prescription drugs currently when you turn 65, I would strongly suggest looking at a Part D or prescription drug health plan because there is a late enrollment penalty if you don't sign up for Part D when either you turn 65 or you leave employer coverage. And we'll touch on that as we go through this. So here are your Medicare options to cover that 20% gap. You have Original Medicare, which is that Part A and Part B. Think about your inpatient and outpatient services. And on top of that, you can add what's called a Medicare supplement from a private insurance company. Just to name a few, Aetna, Humana, Cigna, WellCare, etc. There are dozens upon dozens of types and companies that supply Medicare supplements. Then you would also add a subsequent standalone Part D prescription drug plan. So that's option one. You could have Part A and Part B, add a supplement, and add Part D, and that will alleviate most of that 20% that Original Medicare does not pay for. Option number two is a Medicare Advantage plan. This is also from an insurance company, and it includes Part A and Part B, and it will cover a portion of that 20% gap. Medicare Advantage, a lot of the times, if we're making comparisons, feels and looks like quote unquote traditional health insurance from an employer. You may have a max out of pocket, you may have co-pays, deductibles, co-insurance, itemized co-pays per occurrence, very, very similar to that of a traditional health plan that you guys may or may not be used to. Now, with Original Medicare, you'll pay a share of the cost. So let's talk about this. As I said, most seniors will get Part A at no cost. There's always outliers, but as long as you worked 40 quarters, 10 years, and you paid into Social Security, you will obtain Medicare Part A. Part B, however, comes with a premium payment, and it depends on how much your adjusted gross income was for the year before, sometimes 2 years before from a look back perspective. So If you file as an individual, for 2024 at least, it's $103,000 or less. 206 if you're filing jointly. Your Part B premium is $174.70, and I won't go through all these. You guys can, I'll give you a copy of the presentation after. But you can see the breakdown. As your income goes up during retirement, so does your Part B premium, and so does your Part D premium for prescription drug plans. It's called an IRMA payment, or an income-related monthly adjustment amount would be the long name for it, or IRMA, and it depends on your income from year to year. This will also fluctuate through retirement as your income goes up or goes down, depending if you're taking RMDs from investments, you have annuities, you have pensions, Social Security, etc., maybe the sale of a home, your IRMA payment will be affected. This payment either gets billed to you directly, or if you choose to take Social Security during the time that you age into Medicare, you can have that payment come out of your Social Security check, whichever you prefer. They can either bill you monthly or quarterly for your Part B, or they can just simply take it out of your Social Security check. All right, so this is what original Medicare does and doesn't cover. So if you are just on Part A and Part B, which I would almost never suggest, but if you are just on original Medicare, all right, your Part A costs would be, again, $0 for most people, as long as they work 40 quarters. Then you have a Part A deductible, which is $1,632. Hospital stay copays, if you stay overnight in the hospital for 60 days, you pay nothing. From days 61 to 90, you pay $408 a day, which can become a really hefty bill. From 91 to 150, you pay $816, and after 150 days in a hospital, which we have had clients have to incur, they pay 100% of the bill. The client does, not Medicare, which is crazy. Skilled nursing stay copays, days 1 through 20, you pay nothing. Day 21 to 100, you pay $204 a day. And after 100 days, again, you pay 100% of that skilled nursing facility. If you have to go to rehab, you need short-term care, etc., again, that bill can become pretty hefty. Your monthly premium from Part B, depending on your adjusted gross income, could be between $174.70, this is the cost this year, to $594 in monthly premium. You have a Part B deductible as well. Again, this is for more of your outpatient services of $240 a year. Once again, Medicare pays 80%, you pay 20%. All right. Here are some average out-of-pocket costs. This is between 2019 and 2023, a study was done. Okay, and this is directly from Medicare.gov. So the average 65-year-old male or female incurs, at least over the last 4 years, an average of $135 a month in Part B premiums. They're not paying any other premiums, let's say. Their inpatient care is about $38 a month. Outpatient prescription drugs, and this is insane from a stat perspective, the average American on Medicare is paying $328 a month for prescription drugs. Dental services, about $42 a month, and any other healthcare services, $111, for a total monthly cost of $654.50. This is, once again, if you were solely on original Medicare Part A and Part B, all right? So how do we alleviate some of these costs? The first way is with a Medicare supplement. So a Medicare supplement, unlike original Medicare, is offered through private insurance companies. You're purchasing a private plan from, again, an insurance company like Aetna, Cigna, Humana, United Healthcare, just to name a few. There are tons and tons of them. This is also known as a Medigap plan. If you or your loved ones or friends or colleagues are doing research and you hear Medigap, because a lot of blog posts and forums call it that, just think Medicare supplement. They coincide in terms of terms. And this Medigap or Medicare supplement plan is going to alleviate copays, coinsurance, and yearly deductibles that original Medicare does not pay. This is why I have a job, because this chart is extremely confusing. So in the Medicare supplement space, there are numerous plans that you can enroll in. A, B, C, well, A, B, D, G, K, L, M, N, C, and F. If you were Medicare eligible 2020 or before, you're eligible for CNF. Otherwise, you have to enroll in something between Plan A and Plan N. Again, we'll send you guys this chart so I don't have to read through the whole thing in front of you, but each one has different costs in terms of a premium selection, and each one has different coverage amounts. The most basic ones and the most common ones that we sell across the country are Plan G and Plan N. Just to touch on these really quick, Plan G is the new quote unquote Cadillac Medicare supplement plan, okay? This will alleviate all of the costs associated with that 20% that original Medicare does not cover outside of the Part B deductible. So we mentioned 2 slides ago, the Part B deductible is $240 for this year. Once you meet that deductible, if you are on a Plan G, everything else is covered. You could have open heart surgery. You can have to visit a primary care physician. You can be in the hospital for 50 days. It doesn't matter. You're not paying anything as long as you're paying your Plan G premiums. Plan N is very similar, except there are a couple of co-pays associated with Plan N that we'll dive into. But these are the 2 most common. Arguably, even though I can't be biased based on rules from Center of Medicare and Medicaid Services, these are arguably the most cost-effective plans in terms of premiums that you pay versus benefits that you are given. All right. Oops. Okay. So let's talk about the numbers and how they apply for a 65-year-old male with Plan G coverage. So Plan G, like I said, will cover all expenses except Part B, right, which is $240. The Part A deductible is $1,632, and that is completely negated if you are on a Plan G. It also alleviates 20% of the billed amounts due from Medicare, and it completes any excess charges that your doctors may balance bill. All right. So your total out of pocket, if you decide to enroll in, let's say, a Plan G this year versus just staying on original Medicare, talking about averages, spending money on the Part G will cost you about $268.50 in today's money. And that incorporates original Medicare plus the Plan G versus the average that we talked about a couple slides ago of $655 a month. So even though you're spending to get a privatized healthcare plan, right, in terms of a Medicare supplement, you are saving almost a third of what your average monthly expenses would be if you didn't enroll in said plan. All right. Option number 2 is a Medicare Advantage plan. So let's talk about how that fills the gaps. Unlike original Medicare, a Medicare Advantage plan is also offered through private health insurance companies. All right. The one benefit of a Medicare Advantage plan, well, among other benefits, is that it has extremely low or sometimes no monthly premium. Okay. It is subsidized by the federal government. So this can also help alleviate copays and co-insurance. It can provide yearly deductibles and max out-of-pockets. It could also help you stay inside networks for doctors and hospitals to help you alleviate even more costs. And again, like I said earlier, a Medicare Advantage plan is more so like a traditional healthcare plan. You will see copays, co-insurance, max out-of-pockets, etc. So let's talk about the numbers on this. So if you have a Medicare supplement versus a Medicare Advantage, on a Medicare supplement plan, you will have a monthly premium. On a Medicare Advantage plan, sometimes you will, but most of the time it's $0. If you have a Medicare supplement plan, you will also need to pay for a Part D plan plus dental and vision. Medicare Advantage usually has them included. Now, the next, we'll say 6 or 7 columns are extremely important because even though Medicare supplements don't necessarily come with all the added bells and whistles like a Medicare Advantage plan would, it alleviates all the co-payments, all the out-of-pocket expenses for the most part outside of the Part B deductible. You can pretty much go to any doctor that at least bills to Medicare. Your plan can't be taken away from you, and you have the ability to travel the country and go to any doctor or hospital. On a Medicare Advantage plan, there are still networks involved. There are HMOs, POSs, and PPOs, similar to that, like I said, of traditional healthcare. So you will see co-payments, you will see max out-of-pockets. You may or may not see restricted networks to doctors and hospitals, depending on the plan that you choose. You can appeal coverage decisions. Your plan could be dropped by the federal government. It could be canceled based on the zip code that the plan is in, and it doesn't give you the ability to travel all over the country and see everybody. So there are pros and cons of both. A lot of them has to do with the overall amount of money that you are spending on each one or on the out-of-pocket expenses. All right. So let's talk about choosing what's right for you. On Medicare Part D, this is technically an optional program, and I hate that the Center for Medicare and Medicaid Services declares it as optional because there is a penalty associated with not enrolling in a Part D plan, but still, it is optional. It's federally enacted, but it's administered by private health insurance. Again, think Humana, Cigna, Aetna, WellCare, et cetera. Part D is prescription drug coverage. Part D plans are required by federal law to offer the basic benefits offered by Medicare. So let's talk about what those are. People, in order to enroll in a Part D plan, choose it one of two ways. They either choose a standalone insurance plan that you buy to cover your medications, and that's in conjunction with a Medicare supplement 9 times out of 10, or they have it included with their Medicare Advantage plan. Okay, it's called a Medicare Advantage Plan plus Part D, or MAPD. All right. Now, prescription drug coverage. This is probably even more confusing, arguably, than the Medicare supplement chart. So I'll walk you through this real quick. On Part D, the deductible can be anywhere from $0 to $545 annually. And these numbers change every year. I'm sure you guys have to do CEs in the real estate realm. We have to do very confusing CEs every single year to be able to facilitate Medicare. So this year is $0 to $545 annually for a drug deductible. Then from $545 to $5,030, you're responsible for the co-payments on your drugs, depending on the tier that that drug is, tier 1, tier 2, tier 3, tier 4, whether it's generic or brand name. Then from $5,030 to $8,000, if you've researched Medicare before, or you have parents, grandparents, family members that are on Medicare, you hear them complain about the donut hole constantly. And this is the coverage gap that you will have to pay 25% on generic name drugs. The RX plan would pay 75%, and you'll receive a 70% discount on brand name. So we have clients that may be on blood thinners like Eliquis, or they may be on generic statins, whatever the case may be. So based on their specific formulary, we have to reshop their drug plan every single year to maximize their benefits versus their overall costs. If you're enrolled in Medicare currently, or you know somebody that is, please advise them to reshop their Part D prescription drug plans every year, because it is ever evolving and ever changing. And that's what their agent is here for. And if you don't have one, that's what I'm here for. Over $8,000 in 2024 is called catastrophic coverage. And this year, you don't have to pay for anything drug related over $8,000 in terms of a true max out of pocket. So let's talk about enrollment dates and who is eligible. At age 65, technically, you are eligible for Part A and Part B, even if you still work. So you can enroll in Medicare even if you're working. That's usually a misnomer that people think they have to enroll in Social Security or quote unquote retire to get Medicare benefits. That is not true. You could also technically leave an employer's health plan and enroll in Medicare if it's more affordable, better coverage, etc. You also may be eligible for Medicare through your spouse, although you still must qualify by age or disability. And you could also technically qualify for Medicare Part A and Part B if you're under 65 and are disabled. Now, recently, the federal government, as long as you qualify based on the quarters that you worked, automatically enroll you in Part A. So in your initial enrollment period, which is 3 months before your 65th birthday, during the month of your 65th birthday, and 3 months following your 65th birthday, you have your initial enrollment period, and you'll be mailed out a Medicare card with your Part A effective date. Part B at that time is technically voluntary. If you still have credible coverage and you don't necessarily want to switch to Part B, you can totally stay on your employer's plan or privatized plan or whatever the case may be, or you can choose to enroll in Part B at that time as well. Because remember, Part B, they're going to start charging you as soon as you're enrolled. So again, the Medicare initial enrollment period, the first time is the 3 months prior to turning 65, the month in which you turn 65, and 3 months after you turn 65. If you retire after 65, enrollment depends upon whether you're on an employer-sponsored plan or not, or you're newly qualified because of a disability. Now, there's your initial enrollment period, and then there's multiple enrollment periods throughout the year. So let's touch on these. Your Medicare supplement enrollment period and your Medicare Advantage enrollment periods are slightly different. So Medicare supplement enrollment periods starts with your open enrollment period. Again, this is the same as Part A and Part B, which is 3 months before, the month of, and 3 months after your 65th birthday. Medicare supplements have underwriting guidelines associated with them. However, they are a guaranteed issue. You can have every medical condition on the planet, and if you're enrolling during your open enrollment period, you're automatically qualified for whatever the preferred rate is, regardless of health status. All right. The second enrollment period to be cognizant of for Medicare supplements is a special enrollment period. This is guaranteed issue right or another qualifying circumstance outside of open enrollment. Not all plans have guaranteed issue during special enrollment periods. Also, there's an outside enrollment period in which you must pass medical underwriting. There's no guaranteed issue. Technically, I'm just speaking in generalizations right now, technically every enrollment period outside of your open enrollment period is an outside enrollment period. Very confusing, but to make it in simple terms, if you enroll in a Medicare supplement plan when you turn 65 and it was guaranteed issue, and you would like to switch companies for whatever reason, you don't like their customer service, there's a better rate out there, etc. In order to switch, you must pass medical underwriting. Now, the nice part is they're not going to underwrite you with like blood or urine or anything like that, maybe like a life insurance policy, but you will need to answer something like 8 to 15 health questions and not have any knockouts. I will tell you, because Medicare supplements are still mandated by the Center of Medicare and Medicaid Services, all of one individual plan is exactly the same. So every Plan G for Medicare supplement, right, a standard Plan G, has the same benefits, whether you choose Company A, Company B, or Company C, doesn't matter. Same thing, Plan N, Plan A, Plan L. So all of the plans from a Medicare supplement capacity on that chart that you saw, all of those plans in said category are exactly the same from company to company, all right? Here are some important dates for Medicare Advantage. October 15th through December 2nd is known, or December 7th, sorry, is known as the annual election period, or in our industry, AEP. And you're allowed to switch Medicare Advantage plans or prescription drug plans anytime during that period, guaranteed issue. There's no medical underwriting for Medicare Advantage. Any amount of times and anytime before December 7th to get a new plan effective January 1st. So again, if you know somebody on a Medicare Advantage plan outside of a supplement, right, it's super important to shop those plans between those given dates every single year. Plans change, plans get dropped, plans get added, drug formularies change, copays change, etc. So every October through 15th through December 7th, we're calling every single one of our clients across the country and making sure we review their plan options. Then January 1st through March 31st is technically the annual disenrollment period if choosing to go back to original Medicare, or it's the open enrollment period, or OEP, for one plan switch on Medicare Advantage. Let's say you went shopping October 15th through December 7th. You thought you liked said plan. You looked at it, you had experience with it for a week, 2 weeks, a month during the following year, and you're like, I absolutely hate this plan. I made a boo-boo. We can switch you back to whatever plan you were on or a subsequent plan during January 1st through March 31st. Once that open enrollment period is over after March 31st, you are essentially locked in that plan until January 1st of the following year. So choose wisely, and also have an agent in your corner to help you choose wisely. Here are some other helpful resources. If you want to research on your own or you have trouble sleeping, you can go to Medicare.gov and get the Medicare NU Handbook. It's published every year. Plan changes change every year, copays, deductibles, etc. You can print that out. You can also print out Choosing a Medigap Policy, a guide to health insurance for people with Medicare. So those are all on the government website on Medicare.gov. A couple other things that you should consider real quick if you are eligible for Medicare or you know somebody that is. Things that are not covered by all Medicare plans are cancer, heart attack, and stroke plans. There is a 1 in 2 shot of a male being diagnosed with cancer over the age of 65. There's a 1 in 3 shot for a female. So cancer plans are huge, especially in the over 65 market. Also, dental, vision, and hearing plans, supplemental, or making sure they're included in your Medicare Advantage plan. Medicare does not cover long-term care, and these costs get more and more expensive every single year. So I would look into long-term care insurance, either a physical policy or asset-based long-term care. And if you have questions on that, we do that across the country as well. So we're happy to give you advice on that. And then standard life insurance policies are obviously not covered by Medicare. Just a shameless plug real quick. Why choose us? We are independent agents that work for you. We have pretty much every carrier in the state of North Carolina, as well as nationally. We are not an insurance company. We are just brokers. So we hold no bias to any other insurance company. We shop all of that available Medicare and prescription plans in the state, and we don't charge any fees for advisement. We are paid a commission from the carrier, and that is it. So you'll get an experienced agent to help you with all of your plan choices, and not only on the initial enrollment period, but as we shop through our tenure of our relationship together. So I appreciate your time today. If you want to take down my contact information, you're more than welcome to. Our website is allthingsinsurancegroup.com. Again, my name's Pete Fournier, and I appreciate the time. So we can open it up for some questions. If you would like to, I'm happy to answer or address anything that you guys have.
Okay, thank you, Pete, for that complicated, overwhelming presentation of our system.
That's why I have a business, you know?
Yeah. I'm glad that we have somebody to assist us with all of this. So here I have a couple of questions that people
Sure.
have sent in, and when should they start, when should they meet with you to either change or even get started? I know it sounds like you have to do 3 months ahead of time, but when is the ideal time to there? Don't feel rushed, you don't feel rushed. When is that?
Yep. So the nice part about when you're turning 65 is we could pretty much get you a plan 2 or 3 days before your 65th birthday. It's not a huge deal. However, I would start looking at plans, especially if you want to kind of overanalyze everything that's available to you, 60 to 90 days out prior to your 65th birthday. And then what we do is we post date that policy for the month of your 65th birthday. So if, God forbid, you need to make a change or something of that nature, you have plenty of time to do so. So I would say 60 to 90 days out. If you're over the age of 65 or already enrolled in Medicare, just feel free to reach out. You may have a special enrollment period. You may have a designated open enrollment period, or for lack of a better term, we'll just discuss the plan that you're on and say, hey, there's no special election periods for you right now, but we can help you in October. So always feel free to reach out with questions. It doesn't have to just be when you're turning 65.
Okay. I am self-employed,
Mhm.
and I'll always be self-employed. Can
Yep.
I keep my coverage when I turn 65 or do I have to go into Medicare?
Yeah, great question. So you don't have to go into Medicare. You will, if you work 40 quarters and you qualify based on paying into Social Security, you will get Part A. But it could be your secondary, right, form of insurance. But you can totally stay on creditable coverage, whether it's on the exchange, private plan or through your employer. A lot of the times, we either see our clients retiring early because if we put them on Medicare, it's actually way cheaper than if paying for their creditable coverage, or it's the reverse. They may have really awesome benefits that they're not paying a lot for, and we try to kick the can down the road from a Medicare perspective. So we'll do the comparison for you.
Okay, that's good.
Mm-hmm.
There's some hope.
Yeah, yeah, 100%.
All right. Looking here, it pretty much everybody's questions that I have, you answered. So I don't have any other questions for you. Does anybody else have any questions that you may want answered before we leave? Okay. Well, you know how to get hold of him in the chat. I did put his information there. So if you want to take a picture, if you haven't done so already. And I know my head is kind of spinning with all of that. I'm really glad that there is actually somebody, like a human being to talk to. All right, I think that is it. Thank you so much
Thank
for
you guys. Appreciate the time today.
everything. Yeah, I will send everybody this recording, and if you have any questions, I can, forward that. I'll still forward that information, and you'll send me that little chart, right?
Yep.
We'll make sure you get that chart as well. Well, everybody, you have a great day and happy Memorial Day weekend, and we'll see you guys soon. Bye-bye.
Take care, guys.